Hi sir, good day. So I'm Noel Almilor, your medicine student for today. So I'm gonna do a physical exam of your head and neck. So I'm gonna ask your name first, sir.
My name is Dante Esman.
Birthday and age.
I am 14 years old and I was born in September 19, 2006.
Okay, sir. Thank you. So, sir, I'm gonna check your eyes, your ears, your nose, your mouth, your tongue, and your neck. So, is it okay for you, sir?
Yes.
Okay. So sign this consent. If you agree. Thank you, sir. So, without further ado, sir, so now let's begin. So, assuming I'm done with my hand hygiene, so let's start with the static finger wiggle test. So, cover one eye, sir, and look at me. Okay, so look at my. So, since you cover your right eye, so look at my left eye. Okay, so tell me if you can see the movement of my fingers as I move forward.
Yes.
Okay, thank you.
Yes.
Thank you. Yes. Okay, so you need to do you need to check for all the quadrants. So now let's check for the other eye. So you can also use the clock technique. Okay.
Yes.
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 Okay. Good.
Yes.
Okay, that's good. So we have normal. So next is to do I need to inspect for your cornea and your conjunctiva and your sclera. Okay, so I'm just gonna pull this lid down. Okay, so sclera is white and conjunctiva is pink, so that is normal. So now let's begin. Let's move on with with using our pen light. Let's dim the light first. So let's do a pupillary light reaction. So let the patient stare at the distance and use the pen light to light obliquely. Okay, so as you determine the reaction of the pupil as they constrict. So as the test eye, that is your direct reaction. So it constricts as you move the light towards the eye, and the other one is consensual reaction. So there is constriction also for the untested eye. Okay, that's good. So there's normal reaction. So now let's move on to the corneal light reflection. So as I as the patient look at the light, so there is a reflection on the cornea. So usually it is in the medial part. Okay, sir, can you look at the light? So I can see the reflection of the light in the cornea. So now let me do the cardinal direction, so the 6 ocular movements. So sir, I'm gonna ask you to follow my fingers. Okay, so here. So position your finger at the comfort of the patient. Okay, so usually middle adult and older people, so they tend to be more closer ang distance. So since our patient is 14 years old, so okay. So without moving your head, sir. Okay. Okay, just move your finger up, down. Okay, so you can detect nystagmus there if you're going to the lateral up. Okay, if there is movement of the eyes. So next is let's test for the convergence. So where's my pen? So sir, gonna look at the pen as I move it forward towards the eye. Usually, normally, so the eyes will follow at the 15 centimeter to the 8 centimeter. So okay, so there is a movement of the convergence of the eye. So now we are done with the visual. So we are done with the eyes. So now let's move on to the ears. So here, I have an improvised otoscope since I have no real instrument of an otoscope. So use a large otoscope as possible that would fit the ear canal of the patient. As you begin this, you let the patient position the head towards your towards which ear you will inspect. So pull the ears and pull backward and up. So as you gently insert the otoscope using holding it with your thumb and your index, and you position your hand towards the face of the cheek of the patient so that it would follow any unnecessary movements of the patient. So here, as you insert it gently, you inspect the ear canal if there is inflammation, if there is you call this, masses. Okay, there is blockage. Usually, cerumen can block your way. So I need to clean it up first. Then also, since I cannot let you see the image of the otoscope, so I'm just gonna show you one. So here is the picture of your eardrum. So after you inspect for the ear canal, you inspect for the eardrum. So if there's any perforation, inflammation, or the like. So determine the anatomy if it's normal. So usually you have short process of the malleus here. Then there is the handle of the malleus, the incus. No, the incus is here. This is the umbo. So this is the corneal cone of light from your otoscope. Here is the pars flaccida, the incus, and your pars tensa. So you need to check that because any problem for that, there's maybe retracted eardrums and the like. So next is to do the whisper test. So you need to cover the non-test ear with your fingers and you need to do a circular motion on the tragus so that it would not you call this invalidate your findings. Okay, so first is gonna ask the patient, sir, do you have any problems hearing?
No.
Okay, so usually if the patient would say yes, so that is highly possible nga na-siya problems hearing. If the patient tells you that he has normal hearing, so usually there's a 0.13 na probability that the patient have a hearing problem or not. So there's only 0.13. So you will whisper. As you whisper, you need to first is to exhale completely, and so that to ensure a quiet voice. Okay, then you whisper for a combination of a letter and a number. Like for example, 9B2. So like that. So you need to whisper like that. So a combination of an alpha numeric combination. So let me begin. So sir, I'm gonna cover the other here. Okay. So tell me what you can, what I have whispered.
3U1.
Okay. So when you whisper it, be sure that it cannot be seen or cannot be read by the patient. So your lips cannot be read. So laterally you should not. So other ear, sir.
4A2.
Okay, so that's good. So the patient got my combination, alphanumeric combination. So the patient has a good hearing acuity. So next is to do, I'm gonna use my tuning fork. So this I got here a 512 hertz tuning fork. So this is recommended because it is the normal conversation speech. Okay. So how do you use this? So you're gonna slide your thumb and your index towards like that, so you can hear the make a sound. So you can also tap it here in front of the elbow like that, so that you could use So first is we're gonna test for the Weber's test. So Weber's test is the testing for localization. So gonna tap here, put it in the middle of the head. So can you hear it, sir?
Yes.
On both sides.
Yes.
Okay. You can also position here in the middle of the forehead. Okay. So that's lateralization is good. So now for the Renee's test is to test for the air conduction and bone conduction. So same technique. So tap it here, then position it in the here. Mandible. So it's good. You need to tell me if you have the sound is gone so that I can position it again. So is it gone?
Yes.
Okay, so air conduction is longer than the bone conduction. So let me test on the other side. Okay, so in testing for the air conduction, you need to position. So you need to make sure that the U faces towards you, so that the sound is mas claro, so mas stronger ang sound. Okay, so now let's test for the nose and paranasal sinuses. So we're done with the ears. Okay, so for the nose, let's use the largest, the widest and largest na otoscope. Tapos available. Tapos you insert it As you insert it, the handle should be at the side so that it would not hit the patient. As you check for the, you inspect for the septum, the nasal septum, the nasal mucosas, the turbinates, and the anatomy of the inner ear. Okay, as you insert it, so sir, I'm gonna insert, okay? Okay, so since this is just an improvised, I'm gonna show you a picture. So you need to test the left and the right nostril. Okay, so here. So in testing for it, so you need to be going up in a direction going up. So first is you need to check here in the inferior turbinates, then towards the septum, nasal passage, then towards the middle turbinate. So usually the most accessible turbinate, the most accessible is the anterior portion of the nasal septum. That is the location of your mostly of the epistaxis because that is due to trauma ipik ang nose. So also, if to test for the blockage, you need to let the patient kanang apply pressure to the other nasal nostril, tapos if breathe out siya or breathe in, breathe in. If okay ra siya, so normal, there's no blockage. So inhale, sir. Okay, how about the other side? Okay, so that's good. So no airway blockage. So now let's test for the sinus tenderness, if there are paranasal sinuses. So since the palpable ones are only the frontal sinus and the maxillary sinus, so that is what we are gonna test now. So usually our frontal sinus is below the bony brows. Okay, so bone of the eyebrows. So we are gonna push it. This pain, sir? No. How about this one? So usually, if it is associated with fever, any fishy odors, something like that, any nasal discharges, usually that is positive for sinusitis or rhinitis, like that. So now we are done with the nose and paranasal sinuses. So now let's move on towards the mouth. So we inspect for the mouth. So you need to have a tongue depressor. So since I don't have one, so I have here a fork, like this. So wear a glove. So as you inspect the mouth, because you're gonna grasp the tongue to check for the ventral side and dorsal side of the tongue. If there's any lesions, any inflammations, okay, if there's sores, that. So, sir, I'm gonna ask you to open your mouth so that I can check. Okay. Okay, that's good. So now I'm gonna grab some gauze. Patient to protrude the tongue out, sir. So as you grasp the tongue with your right hand, so you need to palpate for the if there is any nodules, or do it to the other side. Tongue out, sir. And other side. So okay, so there's no mass, so that's normal. So discard everything. So now we are done with the mouth. So now let's begin. Let's move on now to the lymph nodes. So as you do the lymph nodes, you palpate for the lymph nodes. You use your palmar surface of your fingers to palpate. So starting off with the preauriculars. So your preauriculars are in front of the ears. Then towards the postauricular, to the occipital, then to your tonsillar, submandibular, submental, superficial cervical, posterior cervical, your deep cervical. So you can grasp the sternocleidomastoid, okay, so that you can determine the deep cervical. Then lastly is your supraclavicular. So usually nodes are movable, so they can be moved towards up, down, side to side. However, if you detect a mass or muscle or an artery, so this one pass the test na dili siya movable up, down, to the sides. Okay, so now we're done with the lymph nodes. I haven't palpated any lymph nodes there, so you don't have an infection or as of the moment. So now let's move on to your trachea, your thyroid gland. So as you inspect for the thyroid gland, So you stand behind the patient and you let first is you need to determine kana sa movement pa. So let the patient sip some of waters na. Then you observe as the patient swallows. So try to move your back na. So you swallow, sir. So you can see there's a movement there. Easy, sir. So okay, sit here, sir, so I can inspect for your trachea. So as the patient flex the neck slightly forward, so you palpate. Place your fingers on both hands on the patient's neck so that your index fingers are just below the cricoid cartilage. So cricoid cartilage is here. So index fingers like that. Okay, so after as the patient so drink another cup of water, sir, watch the movement upward of the thyroid gland, noting its contour. So manata ganina. So you feel now the movement as it goes up. Sige, sir, ito lang. So, okay, so there's movement here. So displace now is you need to displace the trachea to the right so you can inspect for the right lobe of the thyroid gland. So you displace. So you inspect, you palpate. Lobes are usually somewhat harder and then the isthmus. So your isthmus is in here. So usually 1/3 of the patients have isthmus So usually it is not, but it is palpable but not always. Here's the isthmus. So this is the right lobe. So now to the left na pod. So the anterior surface of a lobe is approximately the size of a distal phalanx. So here, inani na siya kadaka as a thumb. So somewhat feels rubbery pud siya. Okay? So next is you need to note the size, the shape, the consistency of the nodes, the lobes. So you inspect. So usually if there is a benign nodule, so usually it is uniform, ovoid structures, and are not fixed in the surrounding tissue. So, however, normally, so as what I said ganina, rubbery ang ato ang thyroid lobes na. So after that, so if the thyroid is enlarged, so you need to listen if there is any brewy sounds because the brewy sounds are somewhat like a cardiac murmur. So since there is none, so let's not waste our time for that. So now let's move on to auscultating the inspecting for the trachea. So usually you need to measure the distance of your trachea towards your sternocleidomastoid. Usually it is equal. So you test it. Usually you do it with a ruler, so you measure in centimeters. So if it is bilateral equal in size, equal in distance, so usually may trachea is in midline. So after that is you need to auscultate for the trachea to determine if there is stridor. So stridor is a high-pitched musical sound. So this is an emergency problem. So usually that is due to severe occlusion sa upper airways. So okay, so I have auscultated none. So now let me wrap up the discussion, the examination. So the patient is normal because the visual side of the patient, you see the pupils are reactive to light, so I can see the corneal reflection. There is good movement, good iyang function sa iyang 6 muscles, sa ocular muscles. And also when I inspected the ear, there is no perforations, no swelling, no tenderness, and clean ang ear, so no cerumen, and block sa atong way. Tapos there's no perforation of the eardrums and swelling of the eardrums. Then the normal ang iyang anatomy sa eardrums. Tapos we have inspected the nose, so there's no tenderness, no inflammation, no bleeding because wala na siya sa epistaxis. So that's good. For the mouth naman, wala na po siya lesions. There's no any inflammation. Okay. So also there's no nodules sa tongue. So that's good. And for the neck, I haven't palpated any lymph nodes. And also for the the kanang iyang thyroid gland, so it is normally place. Also the trachea is in midline, and I have auscultated any stridor, so that's good. No upper airway obstruction. So sir, thank you for cooperating today. I hope you had a good day.